What causes upper respiratory infections in cats? Have you ever noticed your cat sneezing or having a runny nose and wondered what might be going on? Upper respiratory infections, or URIs, are quite common in our feline friends. Understanding what causes these infections can help you take better care of your cat. Most upper respiratory infections in cats are caused by infectious agents. The primary culprits are viruses, followed by bacteria, and less frequently, fungi. These infections mainly affect the upper airway structures, including the nose, throat, and sinuses. The most frequent viral causes are feline herpes virus type 1 and feline calicivirus. Feline herpes virus type 1 is also known as feline viral rhinotracheitis. This virus can stay dormant in your cat and may reactivate during times of stress or when the immune system is weakened. It can lead to recurring symptoms, which can be frustrating for both you and your pet. Feline calicivirus can cause a range of symptoms, from mild respiratory illness to painful oral ulcers. Together, these two viruses are responsible for about 80 to 90% of feline upper respiratory infections. Bacterial infections can also play a role. Chlamydophila felis is a common bacterial agent that often causes eye discharge and conjunctivitis. Bordetella bronchiseptica is another bacterium that is more commonly associated with dogs but can affect cats, especially in crowded or stressful environments. Fungal infections are less common but can occur, particularly with exposure to environmental sources like bird droppings or decaying plants. Fungi such as Cryptococcus species can lead to chronic upper respiratory disease with more severe symptoms. Transmission of these infections mainly occurs through direct contact with infected cats. This can happen through saliva, tears, or nasal secretions. Sneezing and grooming can also spread the infection. Indirect transmission can occur through contaminated objects like food bowls or litter boxes. The viruses can survive on surfaces for days, making it easier for them to spread. Certain factors can increase a cat's risk of developing upper respiratory infections. Kittens and older cats are more susceptible, as are those with weakened immune systems due to diseases like feline leukemia or feline immunodeficiency virus. Stress and living in crowded environments, such as shelters, can also heighten the risk. Additionally, cats with flat faces may have a harder time clearing infections. From a veterinary standpoint, knowing these causes helps in preventing URIs. Vaccination against feline herpes virus type 1 and feline calicivirus is essential. Minimizing stress, maintaining good hygiene, and isolating infected cats can also reduce the spread. Treatment usually focuses on supportive care, as most viral infections resolve on their own. However, severe cases may requiring antiviral or antibiotic therapy, depending on the cause. If you suspect your cat has an upper respiratory infection, it's a good idea to consult your veterinarian. They can provide tailored advice and treatment options to help your furry friend feel better.